I'm very proud to be the Programme Director for Wavelength. It's a system leadership programme for people who are interested in digital and data innovation.
Wavelength is a really, really important programme that we've been running across the system for the last 4 years or so. For me, I think it's about the way in which we bring people together from different organisations, different backgrounds, different specialties. You've got clinicians, you've got IT people, you've got people who work in administration, all to come together to think about how can we improve the way things we do around here. And you get a real buzz when people from different organisations come together and actually realise we've got something in common here and we want to work together to do this.
So I am targeting anybody at any level of staff who is interested in leadership and is interested about learning new ways of digital innovation in terms of how we can change our clinical and professional pathways for our residents. So we're looking for a positively disruptive conversation across our management tiers, our clinical and professional tiers, and our digital tiers to do things differently.
People are able to make connections from a multitude of different organisations, settings, digital, clinical, operational, and that's really special to have the space to build those relationships, build those connections, because it's those things where you can pick up the phone to someone to unblock something, to help with something that is really enables magic. The leadership component is really, really vital. So all the cohorts receive some fabulous speakers, some tools, techniques that enable them to take that back into the workplace.
My role here today was to do a session on compassionate leadership. And compassionate leadership is about paying attention to someone, to listening to them. And it's to really create a shared understanding of the problems that they have. The key thing is the time and space to think. What we do is we get to work, we get on with our jobs, and we just deliver. What we don't really take the time to do is to network with colleagues, to find out how other people are doing it, to take the time to think about how we might do things differently and to think about how we might make that change so that it's sustainable.
So Wavelength is a fantastic programme, and we know that digital enablement of care makes a real difference. And using technology in the right way to get those better outcomes is what Wavelength is all about. So Wavelength actually brings people together, creates that common language, and then develops projects for people to actually start to work together and start to make a difference.
This is a special place. 2012, I was sat just over there by the Christmas tree.
Well, it's lovely for me to come back to Eton Dorney, where I competed in London 2012 in this lake and be part of the Wavelength programme. I guess the real messages that I'm trying to get across are to be really clear on what choices we're making, that all of the time we've got a choice as to how we're going to show up and to I guess, show up using the best version of ourselves. And the other message I want to take is the one about Team GB and what we managed to do here in London 2012, where when I started my rowing career, 1996 Olympics, all of Team GB got 1 gold medal. London 2012, we got 29 gold medals. What do we do that's different? Well, I think what we do that's different in Team GB is working as a system where we're sharing talent, we're sharing learning from one place and taking it into another place. Yes, we hit our individual goals, but we do it for the bigger system.
It's been a great experience. The digital transformation element of the course is something that I'm particularly passionate about. I do think there's a lot that we can do to use the electronic records that we've put in place to get some of the less patient-focused work off of our plates so that we can actually spend more time speaking to families.
It has been an energizing experience. So from day 1 to day 5, there is so much difference, but every day has been very different and you're learning so many different things.
It's been a fantastic journey, basically enabling us the space to connect and develop leadership skills, but also be aware of how other people manage change. I think the highlight is probably having to meet so many different people with similar kind of ideas, having the time to connect with people away from our busy day-to-day work environments has been particularly really useful and something not to be undervalued.
Wavelength for me was a challenge. It was thinking about how do I fit into this digital transformation across the system. What does that mean in terms of local authority? What does that mean in terms of community and place? What does that mean in terms of how do we get our diverse communities involved in that system change? And for me, the journey has actually been incredible. It's been about meeting different leaders who are all probably in the same position as me. It's also about thinking about what that means for how we address some of our system problems across communities from a local authority perspective.
Oh, it's just been so great today to get back together with the Wavelength programme, cohort 5. We are such a group of enthusiastic change leaders, and today has really been focused on resilience and really how we're going to continue to build our networks going forward. So it's been a really great day.
Sometimes you need to step outside of the workplace. You need to have a bit of headspace to reflect. It's given some tools to us that you wouldn't think of normally. It challenges ways of how you look at yourself, how you sort of treat others. Overall, it's been a brilliant course.
From the first day, I was applying what I'd learned in my everyday job. So be that contacting people who I'd met because I then knew they existed, or things that I had learned on the course, applying them in the meetings I was at. For example, I recently ran a workshop and I had a practice run, so to speak, in one of our days at Wavelength.
It's been a whirlwind. I came on Wavelength because I have to be a facilitator of change, and it's knowing how to adapt that change so that everybody can understand it, what remit it means for those, and how I can best facilitate them to implement their own change and not enforce it on people. So Wavelength was here to give me the tools to be able to make that happen.
I found it such an inspiring environment to be in, so learning from different people, meeting people so I work in a very strategic role, and meeting people who are clinicians, who are seeing our patients, meeting our residents from the councils, from all parts of our system. I think it's been a really brilliant learning experience as well as social experience.
So for me, I feel really proud to be part of this system, so thank you.
This is about bringing a tribe together, you know, like it's tough out there. We've had tough years through COVID, and this is about like bringing a tribe together so that we can connect. We're all in our different organisations, 30,000 professionals, never see much more than the ward you work on. This is an opportunity to get out there, work with people that you wouldn't normally know, think differently about how to solve those wicked problems.